Pneumonia. As per UNICEF study in 2010, about 3.97 lakhs under 5 children died of pneumonia in India. Pneumonia is a form of acute respiratory infection that affects the lungs. The lungs are made up of small sacs called alveoli, which fill with air when a healthy person breathes. When an individual has pneumonia, the alveoli are filled with pus and fluid, which makes breathing painful and limits oxygen intake. Pneumonia is the single largest infectious cause of death in children worldwide. Definition of pneumonia. Pneumonia is an infection and inflammation of lung parenchyma. It is a condition which primarily affects the terminal airway and air sacs known as alveoli. Classification of pneumoniae. On the basis of anatomic part of lung parenchyma. Lobar pneumonia. Pneumonia is confined to one lobe. Bronchopneumonia. It is also called generalized pneumonia. It is scattered throughout the lungs. Interstitial pneumonia. Interstitium of lungs is infected due to bacteria, viral or fungus. Mycoplasma pneumonia is the most common cause. On the basis of etiological classification. Bacterial pneumonia or typical pneumonia. Viral pneumonia or atypical pneumonia. Fungal pneumonia. Pneumonias from other etiologies. Infective agents. Non-infective varieties. Under broad classification. Community-acquired pneumonia. This type of pneumonia occur in community where patient lives. Nosocomial pneumonia. It is a type of pneumonia in which symptoms appear within 48 hours of hospitalization. Ventilator-acquired pneumonia. It is associated with endotracheal intubation and mechanical ventilation. Aspiration pneumonia. It refers to pulmonary consequences resulting from entry of endogenous or exogenous substances into the lower airway. Hypostatic pneumonia. It occurs because of hyperventilation in patients due to prolonged bed rest, immobility or shallow respiration. Chemical pneumonia. In this type, inflammation and tissue damage occurs due to inhalation of toxin chemicals. Etiology. Bacterial. Streptococcus pneumonia. Staphylococcus aureus. Haemophilus influenza. Pseudomonas aeruginosa. Klebsiella pneumonia. Mycoplasma pneumonia. Anaerobic bacteria. Atypical bacteria such as Legionella and Mycoplasma pneumonia. Fungal. Histoplasma capsulatum. Blastomycosis. Cryptococcus neoformans. Pneumocystis jirovecii. Coccidioides immitis. Viral. Rhinovirus. Coronavirus. Influenza. Para-influenza. Protozoa. Pneumocystis carinii. Aspirations of fluids, food vomitus or saliva. Chemical. Inhalation of caustic or toxic chemicals. Risk factors. 1. Immunocompromised patients. 2. Condition which interfere with normal drainage of lungs. 3. Smoking. 4. Air pollution. 5. Chronic disease like diabetes. 6. Aspirations. 7. Prolonged debilitating diseases. 8. Older age. 9. COPD. Pathophysiology. Clinical manifestations. Difficulty in breathing by use of accessory muscles of respiration. Rapid heartbeat. High-grade fever. Productive cough with purulent sputum. Tachypnea. Chest pain aggravated by respiration and coughing. Nasal flaring. Fatigue. Diagnostic evaluation. History. Physical examination. Chest radiography. Skin test. Blood and urine test. Pulmonary function test. Management. Medical management. The main goal of medical management is to maintain adequate gas exchange, Treat infection. Promote airway clearance. Antibodies therapy. Oxygen therapy. Hydration therapy. Warm moist inhalation is also useful. Nasal decongestant and antitussive medicine is also helpful to relieve symptoms. Nursing management. Teach patients about the cause, sign and symptoms and treatment of pneumonia. Monitor patients' vital signs. Auscultate breath sound. Encourage patients to cough and expectorate secretion. Change the position frequently. Maintain patent airway. Minimize risk for aspirations by checking placement of tube and proper positioning of patients. Administer O2 therapy as ordered. Administer medicine as prescribed. Instruct patients to avoid smoking. Encourage patients to take proteins-rich diet. Instruct patients to talk about her fears and ask questions. Encourage good hand washing. Nursing diagnosis. Ineffective airways clearance related to disease condition. Ineffective gas exchange related to disease condition. Hypothermia related to infection. Risk of spread of infection. Impaired nutritional status. Activity intolerance related to dyspnea and malaise. Anxiety related to dyspnea and disease. Complication. Shock and respiratory failure. Atelectasis and pleural effusion. Superinfection.